1 hour increase in social media use increased anxiety and depression symptoms by as much as 6 percentage points.
That's data from Professor Jane Cooley-Freeworth's latest case study at UNC Chapel Hill. Freeworth is the economics professor at the university. She and a team of undergraduate students are collecting data on first-year students to learn about what challenges they face in college. The group wanted to know if social media use impacted students' mental health.
We're looking at some regression analyses, which is how we see what the effects were.
She says the UNC case study shows that increased social media at the beginning of the pandemic didn't have many impacts on students. But 18 months later, when many colleges had reopened, many students who use social media a lot were more likely to be depressed or anxious.
That, to me, is very alarming and adds more to the call that we need to do something.
Kristen Karoff is a junior at UNC. She believes social media is both a good and a bad thing for young adults. She feels exposure to social media can teach students lessons in the real world that can correlate with their college courses and help them make thoughtful decisions. However, Karoff says the negative side to social media can create a false perception of some people while damaging the self-esteem of others.
I think there's a lot of pressure that comes from social media just generally in living like the perfect college experience.
Karoff says she also felt influenced to give her opinion on social media on topics she wasn't educated about.
It can be good in terms of like being more curious, but also sometimes makes you fall into the trap.
The case study shows at the height of the pandemic, depression rate went down, while the anxiety rate stayed high. That's why Freeworth advocates for colleges across the U.S. to have gathering spaces for students to connect, allowing people to join different social groups.
Jatrissa Wooten, Spectrum News 1.